So disaster risk reduction has really occupied an important role in the contemporary society. And so therefore, if you look at the Sendai's framework of disaster risk reduction, it basically talks about 3 to 4 major issues. The first important thing is, as a society, we have to learn and understand what does disaster risk actually means. So if you take a case of, for example, city like Delhi, and if you look at different human settlements, various sort of buildings, their construction, their materials, their height, etc. So many of these settlements have been constructed on areas which are very fragile. So for example, a lot of construction is now being done near the Yamuna river bed. And most of this location is not really suitable for constructions and heavy constructions. So if we were to do construction activities in regions and locations which are not geologically very stable, so we are basically putting ourselves at an advanced risk of disaster, maybe because of floods or maybe because of earthquake. And similarly, if you look at maybe Mumbai or such kind of places where because of congestion, the traffic is a huge problem, whether it's Mumbai, Delhi or any such city in the global south. So therefore it is very important for us as a society strengthening our disaster risk governance at various levels. So when you talk about disaster risk governance, the idea is we should have a clear-cut laid out protocols in terms of whenever any disaster event occurs, then how do various national, state and local administration needs to take call and respond to these disasters and risks. So recently we had this global pandemic of COVID, and that was also declared as a global disaster pandemic, where all countries were very much struggling to respond to how to minimize this spread, how to do testing, how to do making people living in different places so that contamination may be reduced, and then testing was also a challenge. So all these kinds of things, so there has to be a command and control authority at the highest level that must provide informed instructions to various levels of administration so that people may not panic and would respond not only to the situation at hand but should have a plan beforehand. So therefore we call it as resilience to disaster risk reduction. If you think about resilience, we have to work with not only government but also different stakeholders. Through education, through training, through capacity building, we can inculcate the resilience among the people in various places. So for example, let's take case of Japan. Now Japan is a society where right from school days, primary schooling, secondary schooling, college, etc., there is a regular component of training within the school curriculum where children are trained how to respond to a situation of flood, earthquake, tsunami, etc. If these kinds of practices are implemented in other parts of the world, particularly in the global south, we will be more ready to face with these kinds of challenges. So with increasing training, capacity building and preparedness, the resilient in the local population to respond to any kind of exigency and risk will be better, and this will allow for a quick recovery and rehabilitation and reconstruction. And if you see, India has really done well in the last 20-25 years as far as disaster risk reduction. For example, if you remember the major cyclone of 1999 in Odisha, it had led to tremendous loss of human life. Lakhs of people lost their lives, and tremendous amount of property, etc., was also lost. Since then, Government of India, in partnership with various bodies and agencies, has really come up with early warning systems which are helping the local government, state government and national government to timely evacuate people in the event of any disaster going to hit the coast of Odisha. Similarly, with the experience of the tragedy of earthquake in Bhuj in 2001, we learned a lot of difficult lessons. And likewise, the recent COVID-19 pandemic has also informed several new difficult lesson, of course, but will help societies and countries, regions and economies to rebuild their systems, in the sense that the government of India has come up with this idea of Atmanirbhar Bharat. How can we strengthen our supply chains? So when this COVID-19 struck and movement of transportation, aircraft, everything was stuck. So several countries had no food, no medicine, and so in those situations there was this realization of how to strengthen our capacities of supply chains. And so therefore any society must invest in advance in terms of planning, in terms of strategy, and in terms of supplies, that if any situation comes, we are ready to respond to such situation. Moving forward, this new agenda of new urban agenda has also been brought in the global society. The idea of the new urban agenda is, as the global society has become more than 50% urban, and now majority of this urbanization is actually happening in the global south. So what is happening? The most populous city in the world are now shifting towards Asia, Africa and the Latin America. So the idea through this new urban agenda is to come out with clear-cut, well-defined policies how to manage these new forms of urbanization. We have to think about how to manage the municipal cooperation. We have to think about how to create opportunities at the local level, because these cities are huge in sizes, but they are very much diversified in functions. Most of the people, those who are living in cities, are very diverse from different backgrounds in terms of their training, in terms of their economic status, in terms of their cultural. And so therefore city governance is a new important challenge. So the vision should be, how can we provide a better and more equitable future for everyone, those who are living in these urban centers. And so that is an important challenge for us if we were to live and make the world more sustainable. Now if you look at some of the recent statistics, globally we see that world has crossed 50% of urbanization. But in most of these global south countries, the level of urbanization is fairly low, or roughly between 20 to 30 or maybe 40%, as compared to global north, where more than 90% of countries are already living in urban areas. So the point that I want to address here is this, that the process of urbanization in the world is very, very different. In most of the global south countries, the process of urbanization is largely driven by natural increase of population and of course through migration of people from countryside to the city areas. There is not much change in the hardware, basically physical infrastructure in these urban centers. Opportunities are not in ratio of the in-migration of people from countryside to the urban areas. So most of the urbanization in the global south, we all know that urbanization is key for the economic growth of any society, but that is not automatic. It can only play the role of engine of growth in circumstances where the model of economic growth is such that it respects the boundaries of social inclusion and environmental sustainability. If these are not taken care, then what happens? We find that there are regular episodes of various kinds of disease, epidemics. Largely they originate and rapidly, even the experience of COVID-19 also shows us that this virus find its origin and rapid infection diffusion in the urban centers, from Delhi, Mumbai to other part of the country. And so therefore it's very important for us as a human society to manage our cities well, and which means that economic opportunity, social opportunity, all sections of society must find some option to contribute to the process of development in these cities. And that is one of the biggest challenge. The one challenge is how to manage the super big metro megalopolis, and also to ensure that smaller urban settlements must also live and thrive. Because at the end of the day, if the model of urbanization become lopsided, where there are only few megalopolis or metropolitan cities and hardly any smaller urban cities and towns, then what happens that through this unequal urbanization, it creates a lot of pressure on these mega cities. At the end of the day, the management of the city becomes very difficult given the increasing pressure of population. I mean, the recent example is, of course, the Delhi Metro. If you look at the daily ridership of commuters through Delhi Metro, the numbers are mind-blowing. As soon as the Delhi Metro thinks about creating a new line, the demand is increasing so fast that even when they are able to bring up the new line, the actual ridership numbers surpasses this capacity to meet the demand of ridership in the Delhi Metro. So all these things, just one example to tell you that how much stress is there, whether it is power supply, whether it is transportation networks, or if the basic requirements of daily living. Even the policing in this city becomes a tough challenges, because if you have a population of more than 20 million living in a city, you need far more trained and of course the manpower to manage and police this entire area. So the issue of governance is also very critical. And if you see some of the recent statistics, we find that investing in public health is a critical challenge in order to meet all the sustainable development goals. So if we can invest into urban future, urban health, it can help us to address other related issues of reducing poverty. We know that with poor health, it creates a lot of stress on the household to meet the cost of treatment. And some of the studies suggest that, particularly in the global south context, more than 70% of the expenditure on the medical bills is paid by the household's personal resources. And if, unfortunately any member in the household falls chronic ill, then more than 40% of household overnight turns and go into the below the poverty line. So that is the situation in the global south. The issue of health insurance is very critical. Now recently many state governments and Government of India has come up with this national health insurance program called Ayushman Bharat, which provides you a cover of up to 5 lakh for a particular disease in a year. But even then, that is not sufficient given the increasing epidemiological transition that we are witnessing. India is the capital of diabetes. India is also has a huge burden of cardiovascular diseases. And of course, we have this problem of communicable diseases, waterborne diseases, vector-borne diseases. So with these, diverse set of diseases that we have in the country, the issue on, poor child health, infant health, maternal health, and of course the issues of aging and issues of lifestyle diseases make it a very complicated recipe for the local government to respond. And so therefore the need for healthy living and healthy lifestyle is very critical. In urban context, it becomes very difficult, because if you look at city like Delhi or city of any global south, there are hardly open green spaces for people to go and take a walk, or maybe have a chance to breathe fresh air, as one would like to go to mountain areas and take fresh air to feel fresh and come back and do their work. So because of the limitations of these urban open spaces, green spaces, where people can easily go and walk and build their good health and well-being, it has huge cost. Because if people are not able to invest time in looking after themselves, it has a huge cost on physical body and mental health of people. So what happens is the issues of poverty are not addressed well in society where health is a problem. The issues of nutrition also suffers a lot in case people suffer from poor health. Of course, if you are not well because of poor health, education suffer a great deal. There are a lot of studies which says that the first 1,000 years of life of an infant is very critical for their cognitive capacity to evolve. More than 80% of cognition develops in the first 1,000 days. So if we are not able to take care of the children in the first 1,000 days, then what happens that they lose the opportunities of developing 85% cognitively. And hence, even if you are able to somehow invest later on in the life, it's not going to reverse the damage which was done in the first half of the first 1,000 years. So in this way, investing in health has multiple returns. And today we are focusing on urban health because world is now gradually transitioning towards urban future. This urban future is very different from global north and global south. In case of global south, majority of cities are experiencing urbanization because of population influx and natural increase. There is hardly much change which is happening in terms of hardware, basic physical infrastructure, systems of transportation, communication, services. So which means that urban future is a big challenge. And in this urban future, if we are not able to take care of the health of people, it has tremendous deleterious effect on different kinds. Gender equity is one of the biggest challenges in urban areas and elsewhere as well. What is happening is that in urban areas, because opportunities are limited and because people have to struggle to make their daily living, women have to make their life even, if in order to get opportunities, women have to shoulder greater challenges. Reason being that commuting is not easy, opportunities of commuting are not ample, timings is an issue, and of course security problems are also there. So the demand and requirement of addressing gender issues in urban areas is very important. So there is a need to work with community, there is a need to work with men, boys, in order to make sure that commuting is safe, comfortable for everyone. And when we engage all stakeholders, men, women, children, elderly, everyone, we can make commuting more safer and convenient for everyone irrespective of the time. Moving forward, other SDGs are also interrelated. One of the important SDGs is, of course, reducing inequalities, SDG goal number 10. Now what is happening is that in urban areas, predominantly in the global south context, majority of these urban cities, you will find that almost 40 to 50% of this population is living in slums or squatters, so-called unlegal settlements. And most of these slum settlements have no regular services, whether it is power, water, sewage system, food, etc. So they have become a center of illegal activities in many ways. And so therefore it is very important that when they are part of nation or human society, it is our collective responsibility to make sure that the quality of life of people, particularly the slum dwellers, how can we improve their quality? How can we provide better education opportunities to the kids who are living in these places so that they may visualize and have a vision of a better future for themselves, their family, and for the nation as a whole. Likewise, goal 11 talks about the issues of making, in fact 12 talks about the issue of making sustainable consumption and production. Now what is happening is that many people, those who are living in developing countries, do not have enough means to consume and have a nutritious diet. So food insecurity is one of the big challenge across global south, particularly among people who come from poor backgrounds, who do not have job security, employment security, have livelihood problem, and so therefore providing minimum basic food is a critical challenge. In Indian context, we had various instruments to look after how can we provide food security to people, whether it is public distribution system, whether it is Antyodaya program, and many governments have come out with midday meal program for children. Recently the government of Tamil Nadu has come with the idea of providing breakfast to the school children in all the government school of Tamil Nadu. So all these kinds of innovative practices are an example that the nation collectively is moving towards a future where we can take care of as many people from all quarters of life as possible. And that shows our collective resolve to make sure that children, elderly, everywhere is taken care of well. Now the issues of, if you look at institution, is very important. All these agenda, all these commitments can only materialize if we have good governance. We have institutions which can implement this agenda on the ground. The difference between sustainability driven development agenda and the previous colonial agenda is this, that in the sustainability driven development agenda, all stakeholders are working in a horizontal pie. So basically it means that development is not something that only bureaucrats, politicians, etc. should be taking care of. Here the process of development must be driven through the collective action of all the stakeholders of society. So whether it is Gram Pradhan, whether it is social worker, everybody is part and parcel of the process of development delivery system. And with this kind of system in place, the idea of localization of sustainability is really makes sense, where whether you are living in municipal corporation or if somebody is living in a Gram Sabha in a village area, so the different stakeholders are working with the local community in the sense that they can learn what are the needs, what are the pressing problems on the ground. So once you talk to the local public, when you work with the community, you know what public demands, and accordingly one can frame the the development plans for a year that can be met on immediate basis, medium term basis, and the long term basis. So with these various strategies, programs, and issues, the world can move towards a sustainable future. Whether we have this issue of economy, issues of climate change, water crisis, issues of soil quality, issues of protecting biodiversity, promoting individual and society. These are all important pillars of the sustainable society and sustainable future, and they can only be realized through the collective efforts and work of all the stakeholders who occupy and live in a particular territory. But in order to implement them, I think one of the important requirement is also a robust data systems. What is happening is that if you look at the United Nations SDG dashboard, you have these 17 goals and you have got different targets, matrices, a number of indicators which are required to monitor the progress are missing. If you take case of, for example, indicators on health, we have a detailed list of indicators at the global level. But if you have to convert these global level matrices at maybe subnational level, at the municipal corporation levels, or at the village level, many countries, many states do not have systems in place. So the problem is, there is a saying that if you can measure something, you can change something. If you cannot measure something, it's very difficult to change. And similar is the situation with the SDG. There are a number of goals on which we really don't have data either at the national level, thinking about subnational level, etc. is impossible. So the point is that we as a citizen of today's era must have impression upon our government. We create advocacy and pressures on the various governments to come up with data ecosystems wherein we can measure all these indicators. Because, for example, if you see health, go SDG number 3, we still have number of goals on which we have data at global level. And if we can bring down this up to subnational level, it can allow us to allocate resources where it is due. If you don't have robust data mechanisms at the subnational level, it becomes very difficult to actually tailor and distribute resources where it is needed. And so therefore not only allocation of resources, but also to see if a particular program is really giving any benefits to the local public or not. So in order to make sure that the scarce or limited resources reach those who really need them, the robust data system is a requirement. So we have some of these data at the global level, and if you look at some of these statistics at the UN SDG dashboard, it can tell us the global story. For example, if you look at what is happening to the burden of poverty, where it is concentrated, how over time it is changing. So some of these statistics are available, but the point is that these statistics are very few, and unfortunately these statistics are not readily available at the subnational level. So when this statistics is not available at the subnational level, then implementing the sustainability agenda at the subnational level becomes a critical challenge. And so therefore there is a need, of course I know that number of countries do have some of these statistics. For example, Government of India has been implementing this National Family Health Survey since 1992, and we have had about 6 rounds already conducted. However, I mean, if you look at the recent round, only provide us some of these statistics which are relevant to some of the SDG goals at the subnational level, at the state level, district level. But in the first 2 or 3 rounds, this data was only available at the state level. So it is a welcome effort by the Government of India, but going forward, it would be more ideal if you can reduce this level to maybe in a municipality or maybe at the Gram Panchayat level, or maybe we should think about different data systems that can allow us to collect these data to inform data-driven policy making. Because at the end of the day, we want our policies and programs to be backed up with robust data in order to take decisions which are informed and which can deliver result in the long run. Thank you.